Well, good morning, everybody. Good morning, and welcome to Florida Senior Day and the inaugural Town Hall meeting, where we have a wonderful panel of state leaders today to discuss some very important topics facing our older Floridians and their families. My name is Anna Johnson, and it is a pleasure for me to be here with you today moderating. Now, I co-host a program called Ageless in America, and we interview leaders all over the state, and we know that they are doing a lot of good in Florida when it comes to serving more than 4.8 million elders. And I think it's important that we gather for a discussion to evaluate where Florida stands when it comes to aging and meeting the needs of families as our elder population continues to rise. Now, I'd like to take a moment to explain how this meeting is going to flow, and then I would like to introduce our esteemed panel. I want you to be thinking about questions you might have for our panel members, and that is what today is all about. It's about bringing attention to the many important issues for our seniors and having your voice heard. This is your time. For the first portion of the meeting, I will pose questions to our panel members and give each of them an opportunity to respond. They will also discuss the role of their department or organization in the overall aging network and how they are preparing Florida families for the future. During the second part of the program, we're going to take questions from our audience. Now, the most efficient way to do that is for you to fill out your question on the question cards that I hope you found on your seat when you arrived. If you did not get a card, just raise your hand and one of our coordinators will be very happy to bring you one. Now, on the card, you will see that it will ask for your name and where you are from, but don't worry about that. If you prefer not to share that with us, that is okay. So just put down your question. With those details explained, I'd like to introduce our panel. In the center, we have our host for Florida Senior Day, Secretary Samuel Verghese of the Florida Department of Elder Affairs. The mission of the Department of Elder Affairs is to promote healthy aging and to help seniors remain in their own homes and communities as they age. And thank you, Mr. Secretary, for hosting this very great event.
Oh, thank you, Anna. Thank you so much.
From the left, we have Secretary Mike Carroll with the Florida Department of Children and Families, whose primary mission is to protect the vulnerable, including vulnerable adults, from abuse, neglect, exploitation, self-neglect, and to enable adults with disabilities to remain in their community. Next, we have Barbara Palmer, Director Barbara Palmer, with the Florida Agency for Persons with Disabilities. APD is tasked with serving the needs of Floridians with developmental disabilities and works in partnership with local communities and private providers to assist those individuals and their families. Then we have Secretary Liz Dudek. She is with the state's Agency for Health Care Administration, whose mission is for better health care for all Floridians. ACA, as it is known, is responsible for the administration of the state's Medicaid program and for licensing and regulating Florida's health facilities, including long-term care facilities like assisted living facilities and nursing homes. On the other side of Secretary Verghese, we have Florida Surgeon General and the Secretary for the Florida Department of Health, Dr. John Armstrong. The Department of Health works to protect, promote, and improve the health of all the people in Florida through integrated state, county, and community efforts. And finally, down on the end, we're delighted to have Mr. Randall Hunt. He is President and CEO of the Senior Resource Alliance and President of the Florida Association of Area Agencies on Aging. The Senior Resource Alliance has been a great resource in the Orlando area since 1985 for assessing the many services and programs of the state and the federal government that are available for seniors, caregivers, and families. And the Florida Association of Area Agencies on Aging is representative of Florida's 11 aging and disability resource centers. They help persons age 60 and over, as well as their families, to find assistance on various issues, from housing and home care to meals, transportation, and really other important areas. So first of all, let me thank all of our panel members for being here today. Thank you. Our first question to the panel is generally specific. So I know that all of you work together in many ways as Common Health and Human Services agencies, but I wanted to have a discussion and ask each of you for your thoughts on where Florida is headed when it comes to the important issues on aging. For each of you, beginning with you, Secretary Verghese, what role does your organization play in serving seniors in Florida? And what are your thoughts on the future of aging in our great state?
Thank you, Anna. Appreciate that question. And thanks so much for moderating and your continued support for issues that we face here in Florida related to elders. And it's just a pleasure being here today and having you here. And I also want to say thank you again to the fellow HHS agency heads and to Randy as well. Thank you for being here and showing your dedication, commitment, and support to what we're doing and being willing to tackle the tough issues. That's what this is all about. So plain and simple, when we think about Department of Elder Affairs and what we do and what our role is, we need to look first and foremost at us as the State Unit on Aging. We take care of the human services programs when it relates to elders in our state. And also out of that, we also come up with long-term care policy recommendations as well. From that, we have our mission, which plain and simple is that we want to help people stay in their homes and their communities. We know that's where they age best. We know that's what's most important to what people would like to do. When you ask anybody, it's an undeniable fact they would rather stay in their home and their community. Thinking about that mission, also we have a vision that's related to seeing that every Floridian aging well with dignity and with purpose and with independence. So from that vision, we have really 3 goals at the department that we're looking at, and that is the hallmark of what we do and where we're going. We want to strengthen our partnerships, we want to safeguard our resources, and we want to honor our elders. And it's so important when we think about honoring our elders. That's what we're doing today. That's why this town hall is important. That's why I know that 100 or more have driven up from Miami themselves to be here today. So I want to thank you all for making that commitment to being here. So as we honor our elders, we need to continue to think about the legacies that our elders have provided for the state. We think about folks who have been in their communities serving and building legacies of career and family and faith and friendships for 60, 70, 80, 90, some over 100 years. And out of that, that's the role we play. Is we want to celebrate. We want to be able to continue to serve. This is public service. That's what this is about. And thinking about what we do as an agency then in relation to the second part of that question and where we see the future of aging going, we have, as you heard, 4.8 million elders right now today in the state, which is the highest percentage of elders in the nation. I don't think that was a surprise to anyone, but now you've heard it plain and simple. In addition to that, we're going to look at potentially going from 4.8 million to probably about 7.1 million in some of the projections in the next 15 years. So that's going to exponentially increase. And by nature of that, that's something we have to continue to think about, that the issues of aging and the issues of elderly issues are going to continue to grow in the coming years. So that's why these types of dialogues are so important. And we're going to talk a little bit more about that in some of the specifics going on. But I did want to at least frame what we're looking at in this discussion and where we see aging going.
Okay, thank you, Mr. Secretary. Secretary Carroll, what are your thoughts? I know your department houses adult protective services, so you probably also have a unique perspective pertaining to keeping our elders safe from abuse, neglect, and exploitation, something we're all concerned about.
And good morning, everybody. Adult Protective Services is probably the function that we're most well known for as it relates to seniors, and that's the function where we really do go out and try and protect seniors from abuse, neglect, and financial exploitation. But we serve under the umbrella of the department seniors in many more ways than that. In our access program, we determine eligibility for public assistance, including food stamps and particularly for Medicaid, which is a big item for our seniors in the state. We also run several other programs, including behavioral. There I go, right? And I thought a guy from Boston could be heard all through the Capitol, right? But we also have other programs like behavioral health programs, our substance abuse mental health programs, and just like any other segment of our population, there's a significant number of seniors that need help with these issues. We have our domestic violence and homeless programs that we see an increasing number of our elderly in need of. And we also have a refugee services program that serves refugees that come here from other countries. These are folks that are in this country legally, who have fled their country because many cases due to discrimination and persecution for a whole variety of reasons. And many times they come here just with the clothes on their back. Our refugee program serves everybody from infants all the way to very elderly seniors. And so I think our interactions with the senior population is much broader than some think. Today I would like to focus on adult protective services because I think it's an important component of what we do. As we continue to age in this state, some of the most at-risk populations we deal with are our seniors. We investigated last year 40,000 investigations that involved seniors, either from abuse, neglect, or financial exploitation. 30% of those investigations that involved folks over 60 involved an elderly person that had some type of organic brain issue. Many of them had Alzheimer's. And we know that Alzheimer's, not only does it cause issues in terms of leaving you at risk, Alzheimer's, for instance, for our standpoint, that when we investigated seniors that were injured because they were in facilities and they were injured with serious falls and other accidents, the majority of those cases involved somebody who had Alzheimer's. All of these factors place our seniors, I think, at greater risk, not just of injury, but also of being abused and neglected by somebody else, or, quite frankly, victims of financial fraud. And so when you ask, to me, the future, where we're going with some of our elderly issues, protecting seniors from some of these issues has become more complex. I would say the first thing we have to do, and I know a number of my colleagues up here would espouse this as well, we really are within the department trying to promote a healthy living style. It makes a lot more sense, and we as a department work every day to make sure that we can keep seniors in their own homes. One, it's less expensive. Two, it is so much better quality of care and quality of life for the individual to be able to be kept in their own home. So the department, through some of the support services we offer, we try and do that all the time. But part of that is really contingent on all of us making a commitment to live healthier and to stay active, because that will help us stay in homes longer. The other piece of it is we are finding that we have got to partner much more closely with law enforcement, with the Office of Attorney General, because some of the financial fraud schemes that some of our seniors face are significant, and it doesn't take but a short time for a senior to lose all of the assets that they've taken a lifetime to build up. And to me, that is an absolute scourge that we have folks preying on seniors. We in the department can't stop that on our own. We have to partner very closely with law enforcement, and we're doing that going into the future. And then the last thing, as seniors continue to age, we see more and more extended families together. So not only do we have folks taking care of seniors, we have a whole segment of our population where seniors are taking care of kids. And we need to make sure that we have the support in place to help all of our elders that are actually serving as parents right now, making sure that they have the proper supports in place, that if they are providing kinship care, that they can do it in a real effective way, maintain a healthy lifestyle, but also be able to effectively care for their kids. So these are some big challenges that are not unique to Florida. What's unique to Florida is how quickly our elderly population is growing. This is a great place to live, and it's a great place to retire. So the unique challenge we face is that we have this issue in much greater numbers than some other places around the nation.
Wow.
Thanks.
Okay, thank you, Secretary Carroll. I'd like to ask the rest of our panel, when you speak, if you will talk directly into the microphone, because I think some of the people in the back can't hear. Is that right? Right. So let me know. We want to make sure you hear everything that they have to say. So, Director Palmer, it's your time. What role does your organization play in serving seniors in Florida? And also, what are your thoughts on the future of the many services for individuals with developmental disabilities and their families in our state? I understand that you are very interested in conducting a pilot program serving people with developmental disabilities who are aging and developing Alzheimer's disease. Can you tell us a little bit about that, please?
Yes, thank you. Can you hear me? How about way back there? Can you hear me? Okay. I used to be a cheerleader, so you should be able to hear me. Also, I want to tell you, first thing, I actually am in the age bracket that I should be sitting out there with you. So I certainly understand your concerns. I live them every day, just like you do. And I've known Anna for a very long time. We go back, and she has actually championed many things, not just things for seniors, and just an outstanding woman.
Thank you,
and
Barbara.
I thank you very much. And thank you, Secretary, for this opportunity, because I think this is extremely important. Well, you know, we have a challenge in our agency because 75% of the people that we serve live at home. And that's a good thing, but it also presents another challenge for us. And that is, as people age in their home, and I by the way, let me back up and tell you, the agency that I run, we serve people that are born with developmental disabilities, or they become disabled before age 18. And that is autism, cerebral palsy, spina bifida, Prader-Willi, intellectual disability, and Down syndrome, and different spectrums of those disabilities. But what happens is, when you have people that are living at home, two things happen. The caregiver ages, and so does the individual. Now, thank God, because of better health for people, people are living longer, but it also poses some challenges for us. And one of the biggest challenges that we face right now is how to deal with the individuals that are in their homes and let them age in place. Because here's what happens. In our agency, the money comes down federally and from the state in a certain way, and people are eligible for it in a certain way. It also comes down for people that are elderly in his shop this way. Okay, so the money does not come down commingled. So one of the challenges we have, and one of the things we're working with ACA on, as well as Elder Affairs, is how can we combine the money, and instead of looking at how we make the money work for the person, let's look at what that person really needs. And then we worry about the money. So, because what happens is, when you have a caregiver that's aging out, and they start getting Alzheimer's or dementia, and then you have the person with developmental disabilities, what happens? They have to both leave their homes, be disenfranchised from each other, and it costs a whole lot of money. Now, part of what we need to do is to train individuals to go in those homes that are prepared to be able to serve both populations. That training does not exist, and we're in the process right now of trying to come up with a curriculum that can actually cross over both areas. And that's something we will have to work with the Secretary on, and also with ACA, so we can go to the feds and make sure that the money that comes down there can be commingled. We also have the issue of the actual person with a developmental disability that becomes has dementia or Alzheimer's. And what happens is the entire family, when you think about this, when you have a person in your family that has a developmental disability, it isn't just that one person that we need to serve. It's the entire family. It affects every single person in that family, the siblings, everyone. So we have to look at what's the best way to provide services for the entire family. So those are the biggest challenges that we face. But I will tell you something. I've worked in state government on and off for 30 plus years, and I have never worked with such a great group of people as I'm working with right now with HHS. The governor has actually told us, you will work together. And the good thing is we like working together. And we solve problems together. And I see the future as very bright because of the attitude that all of our agencies have in what we're trying to accomplish. Thank you.
All right, thank you. A little side note here. My mom is 102, and I think she's going to live to be 105, believe it or not. But she thinks that my sister and I are like in our 30s, and that we should be able to do everything that she wants us to do. Well, we're only 49, so it's hard. She has no conception of age, which is just amazing, and she's doing so well. Okay, thank you, Director Palmer. And Secretary Dudek, your department advocates for better health care for all Floridians, and you play an important role in the regulating of long-term care facilities. How does ACA serve elders, and what are your thoughts on the future of those services?
Thank you, Anna, for that question. And good morning, everybody. I love the T-shirts. I also love coming in through all of the children's issues. You know, our future, but our future would not be our future without all of you to help guide us in terms of where we need to go. So thank you for that. It is in regulating not only our long-term care facilities, so nursing homes, assisted living facilities, and home health. We regulate about 45,000 every healthcare facility within the state of Florida. And we take that very seriously. One of the things that I have seen, and I've been involved in this similar to Barbara over 30 years, and in going to our facilities, it used to be 10 years ago very uncommon that you would have anybody who was 100 years old. I have not been anywhere lately where there wasn't at least one person who was 100 years old, and they tell me very often, we don't even celebrate till 104 because we have so many people who are at 100. And we're talking people who are like you, bright, vibrant. I mean, the women are killer looking. The men are swamped by the women because unfortunately, or fortunately for the men, there are more women than men in most of the facilities. But our goal is to make sure that we let you be all that you can continue to be. My mom was visiting with me last week. She's not quite as old as Anna's mom. She's 87. I came downstairs, and she's on the floor in like a lotus position. And I'm like, oh, my gosh, Mom, are you okay? I'm just doing my morning yoga. And then she bends and this and that and gets up. And I'm like, okay, so I'm hoping that I can get there. She doesn't know how old I am, though, so I can't fool her about the 49 I'm working at. But it is very, very important for us that the facilities that treat eventually you or anybody that you love are the best facilities that they can be, but also that we allow you to stay at home as long as possible. We have been working on now, one of the first states to allow funding of family for them to be able to take care of their loved ones at home. That reduces expenses that you'd have to have with bringing in a caregiver. You know who the caregiver is. And that's one of the things we've also brought that into something I'll talk about maybe in the next questions related to our long-term care, managed care for our Medicaid recipients, where our goal is we have about 50% of our elders still in nursing homes, the remainder at home. That's where, or in some other kind of independent living, that's where we would like them to be, and that's our focus. We have worked, I saw our ARP friends come in. We have worked in the past and continue to work on different work groups, et cetera, and this year possibly we'll get an assisted living bill passed that will not only improve enforcement in facilities and staff training and areas like that if you happen to need an assisted living facility, but that will allow you to stay there longer. We want people to be able to age in place if they need to go there. Right now it's difficult to get assistance with some things that you do at home in an assisted living facility. So that's our goal, is to make that happen. We also, because you are also bright and vibrant, like the t-shirts are showing, and some of the hats. I love the hats. That hat might be mine when I leave. You are always trying to be more educated on what's available, more knowledgeable about what you should expect and what you shouldn't expect, what you should get and what you shouldn't get. We have a very active website at Florida Health Finder, which provides a ton of information. We even have, if you happen to be somebody who has a cell phone, a cell type, a mobile application that will allow you to see where every healthcare facility is, will allow you to see what their history is, will allow you to see if they've had deficiencies, what those are. We'll tell you about various practitioners in the state. We'll tell you about outcomes of different procedures performed by hospitals, et cetera. Very, very informative information that you can use. For us, you are, as the kids who are out there, our future. And so I thank you for being who you are. And our goal is to make sure that we have what you need in terms of health care in the fashion that you need it, when you need it, and of the caliber that you deserve. So I thank you all for being you and, like I said, being our future.
Thank you, Secretary Dudek. Very good. General Armstrong, I know that your department has many health initiatives that benefit seniors, actually all Floridians. What role does DOH play in serving our seniors, and where do you think our seniors are for their level of healthness? Is there anything that the Department of Health would recommend as they age in their communities?
Well, thank you, Anna, for your question, and good morning, everyone. I'm delighted to be here with you to celebrate success in aging, because let's face it, you had to have a lot of things work for you to be here now. And I think people sometimes forget that when we talk with our seniors, we're talking with a very special and select group. You see, when we're born in the state of Florida, our life expectancy is 79 years. Yet when we reach age 65, our life expectancy is 83 years. And when we reach age 75, our life expectancy is 87 years. So there is a compounding of health that allows people to age. And I think what you're hearing at the front today is extraordinary collaboration that is working to help our seniors in their terms stay active and age in place with grace and dignity. I think that's what it ultimately comes down to. Your Department of Health is fortunate to be an integrated department where we have a state health office. We have 67 county health offices in every community that are there to partner with you to enrich healthy options. We have a variety of programs that appeal to all people in Florida. And our prominent program is Healthiest Weight Florida, where we are working in communities to help Florida's kids, adults, and families make more informed choices about what they eat and how they are active in life. We are working through this program to strengthen communities for independent living of seniors. We are working through this program to help our seniors stay healthy. You know, there is no age limit to eating right and being active. And we are really working in our communities to put a spotlight on our seniors who set the example for healthy living. And I'm going to share with you an example from my own life. My 96-year-old grandfather, he just passed away. I don't think about his death, I think about his life and what it was that has really left a legacy for me. And it was how he chose to live his life. So he was in Idaho, where they have a thing called snow, and until age 95, he shoveled the sidewalks, not only for his house, but for his neighbors. Until just this last summer, he mowed his own yard. He was proud at dinner to bring family together, and he set the example by taking the right portions and making sure, as he was fond of saying, you got a lot of that green leafy stuff on your plate. And the third is that he was very social. And he looked not only for family, but for friends and associates in the community. And he liked to tell his story, the things that had happened that led him to 96 plus years. And I think that is an untapped opportunity in our communities. As I shared with you at the beginning of my remarks, something has gone right for you. You are living into the senior years filled with opportunity. I want our communities to tap into your experiences and your expertise so that our younglings and our young adults aren't making poor choices. They're building on the experiences that you had so that they too can look forward to aging with grace and dignity.
All right. Thank you so much, General Armstrong. All right, Mr. Hunt, now it's your turn. I know that you represent not only your area agency on aging, but the others as well today. And we appreciate you being here today. How do the Senior Resource Alliance and the other area agencies on aging serve the ever-rising population of elders across the state of Florida? What types of services do the AAAs offer? And what are your thoughts on the future of aging when it comes to those services?
Thank you, Anna, and thank you all for being here. I can see Miami is in the house today. Also, some of my colleagues are here, other area agency CEOs, and appreciate their support today. We are the contractual and programmatic partners of the Department of Elder Affairs. We are, in essence, the boots on the ground. We have contact with doing a myriad of screening processes for seniors. This last year, we've screened over 81,000 people into various programs, an additional 27,000 people into Medicaid, and that's without all 11 of us operating for 12 months. Some of the programs that we make sure get into the community, both programmatically, effectively, and financially efficient, are programs you might recognize: Meals on Wheels, Neighborhood Lunch. Some you might not recognize as well, we call health and wellness programs. And one thing I can say a couple things. One, I think we're very blessed to have the 5 secretaries and general we have here. I think you can hear their dedication. You can hear their commitment to seniors and all Floridians. And certainly the Department of Elder Affairs and the area agencies share that. Our mission is similar to Secretary Verghese in that we want seniors to age independent in their home with dignity for as long as possible. And then we're fortunate because we've got some excellent policymakers to make sure when that's no longer possible, we can screen them into appropriate choices that the senior gets to have input in. That's the beauty of Medicaid managed care, is the senior does get input. They get selection choices. That's critical. And so the future for us is clear. The only way we're going to bend the cost curve isn't by creating new insurance programs or variations of that. We're going to get there by what the general said: we've got to be, all of us, more cognizant of our own responsibility to our health. That responsibility isn't just to ourselves, but it's to our communities as well. And I know the program you mentioned, I've been suggested that I participate in that the rest of the year, and so I have a personal goal to lose 30 pounds for the rest of the year. The health and wellness programs that all the area agencies pretty much do, we do evidence-based programs. That means that the money that's being spent on a program that there is clear evidence that if the participants actually carry out the program with its fidelity, that they will be helped immeasurably. We also work on fall prevention, Tai Chi, matter of balance programs that we're seeing in the various senior centers and YMCAs and the community organizations. Chronic disease self-management around helping people live more effectively with diabetes, with heart conditions. So that's the direction that we think that we've got to go as we all live longer, that we not only live longer, but we live healthier, and that we reduce the number of people that need to go into a nursing home, and those that do, we reduce the interval by which they'll need to be there. And so that's the goals that we have.
Sounds good. Mr. Hunt, I don't think your microphone is on. I mean, you project very well, but
I mean, I have a big... Now it's on. Is that better?
there you
I'm
go.
sorry.
Yay! All right. Well, we were going to ask a little bit more from our panel, but time is just running on, so I want to make sure that we get some of your questions asked today. So our first question, let's see. An announcement. The group with the yellow T-shirts are from the city of Miami Gardens, not Miami. Well, we want to get that straight, don't we? All right, here's the question, and I'll let you all decide who wants to take it. How can seniors access more funding in Florida for home care when local agencies have limited funding?
I have the limited funding.
I mean, that's all you hear.
You're not moving that one to me.
Really want to give that to you, Randy. That is a great question. I think, first and foremost, when it comes to any type of resource limitation that's out there, that's important for us as a department. And that actually speaks to the number 2 goal that we have, and that's safeguarding our resources. Plain and simple, as we see that it is more cost effective to keep people in their homes and their communities, that's something that we are always wanting to talk about. How do we continue to do that better? So one of the things I'd love to be able to tell you about is we have what's called a state plan on aging, which is going to be a 3-year projection. And we have a state plan advisory group that includes almost 20 people from a cross-section of stakeholders in the healthcare field. Obviously, we have Randy and his group from the AAAs represented, folks like AARP, Florida Healthcare Association, and several other entities involved to talk about what do we do, because we know that it's not an endless pot of money. We know that there's a limited amount of resources. And when we talk about safeguarding resources, it's important that we think about the individual and we think about the taxpayer. So when we think about the individual, we want to make sure that we're caring and compassionate. When we think about the taxpayer and how do you wed that together, we have to look at things from a business standpoint as well, because if we do things well, if we're effective and cost effective with the programs we have, we can then reach the most people. So that's always a tension at the department that we constantly are trying to walk that line to find the most positive solutions and where we're going about this, so that as we ask you, folks from Miami Gardens and everywhere else in the state who are here today, we want to draw on the expertise that we have in this public-private partnership that is the Florida Department of Elder Affairs. We are about 95% publicly privatized. And that's a wonderful thing, because that gives us opportunities and flexibility to be able to look at the experts that are in the field, get their opinions, get their help, and help us then to make informed decisions in what's going to help people age well in their homes and their communities and do it in the most cost-effective way. So that's a great question.
Well, I know all the agencies fight for money, but in order to do what we want to do, we have to have more money. So has the governor recommended any budget increases for seniors this year? And what are his priorities for seniors?
I could take that, and if anybody else wants to jump in after that.
Well, if
If nobody's jumping out.
No, Sam, before you
Please.
start, if I could do kind of something that bridges, if you will, the last question to this question. Many of you are covered by Medicare, but for those individuals who are covered by the Medicaid program, one of the things that we did in transitioning to managed care was had our plans compete to be able to provide services within the state, and they were able to offer additional benefits, benefits that they would be offering, one, to keep you at home, to keep people healthier. And among those benefits, if you know anything about the Medicaid program, we basically would pay to pull people's teeth. That's what we did in terms of being able to take care of your teeth. With Medicaid managed care, we now have adult dental services that will be available for the majority of individuals. And I don't mean just pulling teeth. You'll be able to get if you have cavities filled, you'll be able to get routine checkups. There are additional visual benefits and other types of benefits. So that's something that we are trying to build into everything that we can do is what can we do to make the monies that we have go directly to what you need and in a fashion that allows you to stay at home. With that, I'm going to transition back to Sam.
And I'd like to pass this to Dr. Armstrong to begin here.
Well, thank you for the question. I think that you have seen in our governor's budgets last year and this year a commitment to finding answers to important health questions for seniors. And one of those areas relates to Alzheimer's disease. And we know that in Florida, just under 500,000 of Floridians have Alzheimer's disease, but we know many more Floridians as family members and friends are affected by this challenge. And so last year, in our governor's budget, and thankfully agreed to by the legislature, was $3 million for the Ed and Ethel Moore Alzheimer's Disease Research Program, where we are giving grants to prominent researchers in our state to find answers to Alzheimer's and not only cure, which is important, but ways to manage with Alzheimer's, ways to support families as they're helping their loved ones deal with Alzheimer's. In this year's budget from our governor that will keep Florida working, there's $8 million that is proposed for an expansion of research beyond Alzheimer's to other brain disorders, because we recognize that there are challenges across the spectrum of life, and we also know that stroke is an issue, and there are some opportunities to find ways to prevent stroke and manage stroke and help individuals affected by stroke to live more fully in their communities. So I think you have a very strong message from Governor Rick Scott and his team that we are invested in finding answers to enrich the lives of our seniors when it comes to brain disorders.
Can I
There's an
respond to
old
that as
saying,
well?
God grant me patience, but hurry. You know, we all want things to happen quickly. You know, when you need help and you go to resources, so many times people have to wait long periods of time, and I think we'd like to see that dwindle down.
Thing I'd like to just say, because I think it's wonderful all of you are here today, and I want you to know how very important that is. If you talk about wanting more money and needing more money for people, you've got to do exactly what you're doing today. But you have to do it locally as well. And by that I mean don't just go talk with legislators, your city commissioners, county commissioners that already side with you, because you're singing to the choir. You got to go to the ones that are not convinced and convince them. You've got to go in with a very strong argument about why there needs to be funding. Do not underestimate that, because one voice can change a lot of things, and people don't realize that, but together think of what you can do. I mean, all of us compete for the dollars, but the truth of the matter is social services together we have to work together to help people that in many cases cannot help themselves.
And if I may, specifically to that as well, the governor has made a commitment for issues related to the elderly and seniors. So much so that he's recommended, in addition to what the Surgeon General talked about with $8 million for Alzheimer's research, he's also recommended over $8 million when it comes to issues just related to the elderly. You heard about the Community Care for the Elderly program that's administered by the AAAs, and also there's Alzheimer's Disease Initiative program as well that helps facilities like Share the Care in Orlando. I had an opportunity to go down there and see an adult daycare center where people are living with Alzheimer's disease, to see your taxpayer dollars at work. And it was a facility that had about 24 folks, and their caregivers were actually there after we were able to spend some time with their loved ones and see all the great things that they were doing there and providing and helping. And as Deputy Secretary Prudhomme and I from the department were able to sit down and listen to the caregivers and hear about just the commitment that the governor's made to be able to continue to fund programs like that, and the help that it was to them to just be able to go on with their daily life, to be able to live, to be able to continue to work and provide for their family was really, it was a matter of them staying in their homes and communities or having to move to a nursing home and get out of that environment. And of course, you know, they wanted to be able to keep them in their homes at that point. So keeping in mind, that is where your taxpayer dollars are going. It's helping real people. I've been able to see it firsthand. I know many of you could probably attest to that as well. And hopefully we'll be able to have that increased funding, as you heard several of the agency heads talk about, with as you see in your local communities as well. And we appreciate your support also. Thank you.
Okay, thank you, Mr. Secretary. Some years ago, my mom attended Senior Day, and she was in her 90s, and she came from Jacksonville. So I understand we have some Jacksonville people here, right? Oh, whoop, in the back, there you are. Okay, Mr. Hunt, why don't we give this to you? Do state agencies work with federal government? Do they work together to help seniors?
You know, I think that that's a political question. From what we see, Washington and the states could probably communicate better.
Let's hope so.
But when it comes to our position, it kind of moves downhill. The federal government and Older Americans Act allocates those dollars to elder affairs, and they allocate them out to us. And so in that regard, I think we're all on the same page. We're working effectively together. There's obviously some areas that are still a work in progress. But I think for the most part, everybody involved in both entities is trying to, in their minds, make the best decisions. It's just a matter of all of us trying to work together more effectively.
All right. We do have one question, and somebody from Tallahassee, and they say, it's hard for me to get my medicine. Is there any help?
Well, I think depending on what the issue is, I would be glad to get the name and number of the person who's having difficulty, and if we can't help, we'll talk to the Surgeon General, and if he can't help, we'll call somebody who can. So it's hard to know without knowing what the particular issue is, what the answer would be, but I would be more than willing to, or if I need to give you my card, I'll do that, and you can call me if that's a better way to do it.
Okay.
Can I follow up? Can I just follow up and say
ahead.
that we would need to understand a little more of the particulars? Is it difficulty seeing a physician or health professional? Is it difficulty in having a pharmacy fulfill the prescription? And so there are a variety of dimensions where we can be helpful. Your Department of Health provides the framework by which all health professions and pharmacies are regulated in the state. And so if there is a particular concern there, I would ask that you call our Medical Quality Assurance Division, and we're always looking for ways that we can help.
Great. Secretary Carroll, at the beginning you mentioned that there were like 41,000 cases of neglect and abuse for seniors. Was that the right number?
Over 40,000, yes.
Over 40,000. If an elder is being abused and it's not reported, does the state have any other way to help? And who can report abuse of an elder?
Thank you for the question.
So many times people don't want to get involved.
And that is unfortunate. I think it's all of our obligation. You know, we talk about this a lot on the children's side. It's true in the adult side, too. We are only as good as the folks we have on the ground. And the folks we have on the ground are not just folks that are getting a paycheck to be on the ground. It's everybody. We all have a responsibility in our community to protect vulnerable adults. And if you see abuse, neglect, or exploitation going around, I can't encourage folks enough to call the hotline, and it's a pretty easy call, 1-800-96-ABUSE. You call the hotline, you relay your concerns, and then we generally are out there within 24 hours to initiate an investigation in Florida. We have one of the quickest, I think, responses of anybody in the nation with that regard. When we go out and investigate adult abuse, it's a little bit different than the child side. Because when you go out and investigate with elders, the first thing we have to determine when we go out is, do they have the capacity to consent? Because we get lots of calls in from family members, for instance, that you know, one family member may think another family member is financially exploiting one of their parents. When we go out, what we have to determine is, does that person have the capacity to consent? Because if they do, then they really retain that right to determine who they give money to and why they give it to them. And so our ability to intervene is limited. But if we do determine that they don't have the capacity to consent and they need help, that's at the point we do intervene, because we make sure that the services are put in place so that those decisions are made in the best interest of the senior. The other piece that we deal with seniors is the primary cause for abuse among seniors is self-neglect. And so it's still that litmus test, right? We go out and, do you have the capacity to consent? And if you have the capacity to consent, it's not like the child investigation. In child investigation, I'm going to go in and the child doesn't have the right to say, I don't want help, but a senior does. And many times when we have recidivism, where we have to go out on a number of times to the same house, it's because the senior themselves don't recognize the risk that they're in, and they don't view themselves as victims. And so the challenge for us is really developing a relationship with those seniors where they can trust us, where they understand that we're there to help them, and that they be open to help. Those are the more challenging ones for us, because I can tell you the bureaucratic response in those cases would be, I would go out and if you had the capacity to consent, I would leave, but that's not what I would do if it was my grandmother. That's not what I would do if it was my mom. And so as a state agency, that's not what I expect our workers to do. I don't care if the person has capacity to consent. If they're at risk and they're putting themselves in harm's way, then we need to work with that elderly person to help them to understand that, and to get them to be open to, for us to actually be in a position to assist them. So we do that, but I do encourage folks to report it. We get reports from all sources. Mostly it's from the folks that are closest to the senior. It's family members. When folks are in institutions, you would think that when you go into an ALF or a nursing home, one of the expectations is that you would be safe. That's not always the case, and we have many investigations that take place in those facilities as well. But I do think the question is, if they don't report it, how do we react to it? It's very difficult. If it's not reported to us, there's no mechanism we have to enter those cases. So reporting really is critical, and everybody has a responsibility to do that. Absolutely. And that, when you make a report to the abuse hotline, the one piece of information that never gets released, whether it's on the child side or the adult side, the one piece that never gets released, even to the folks who work the case, is the identification of who made the report in the first place. So it's anonymous. So I encourage folks to get involved. There's no consequence to get involved. Only good can come of it.
Well, we only have about 2 minutes left, and I have a question here that says, how can we build a strong bridge? I think I would rather say for all generations. How do we build that bridge with everybody? We have a 30-second response, so who would like to take that? Mr. Secretary? There you go.
I'll turn it over to Sam because I know he wants to do it. But I think one of the things that's very important, and Director Palmer, Barbara said it, one of the things that we're trying to do is work very closely together. It's not just that we have lunch together, which we do. It's not that we always agree, because we don't. But one of the things that we do agree on is how can we make the services that we provide, the monies that we get, be best used to provide the services that we need. And the other thing that I think is critical is that we provide you the information that you need to know what you need and how to deal with it, if it's abuse or something else that may have occurred. And to provide you otherwise the tools to be best informed and make the best decisions. So I think, and working with you, one of my big goals is to get out and do as much outreach as possible. I've been to several of the long-term care, independent living type facilities. I did find that I speak faster than hearing can occur sometimes, so I try not to do that. But I think it's really important, and that you know that it's our commitment from the head of the agencies that deal with the provision of services, that we are looking for ideas from you, but we're looking to make our resources go as far as possible, and that's for everybody.
All right, thank you so much. And we'd like to thank Secretary Mike Carroll, Director Barbara Palmer, Secretary Liz Dudek, Secretary Samuel Verghese, Mr. Randolph Hunt, and Dr. John Armstrong, our wonderful panel. Let's give them a round of applause. I would like to just say that how fortunate we are to not only live in this great state, but to have leaders who are working very hard to meet the needs of our valuable and incredible seniors. And today we are honoring and recognizing you. So I do hope you enjoy your day. From our distinguished panel and our host of Florida Senior Day, the Florida Department of Elder Affairs, I want to thank you for joining us for this great forum. Enjoy the rest of your day. I'm Anna Johnson. So long, everybody. Thank you.
Hey, you're ready, girl. You're ready.
Mike, how are you?